Hi, my name is Patricia. I'm counseling psychologist registered with HCPC here in the UK. And in today's video, I'm gonna be talking about what the trauma-focused CBT therapy is. So it's a very specific approach. In general, we have many different approaches, how we can work with post-traumatic stress disorder or trauma. But today I'm gonna be only taking you through very few basic descriptions of what the CBT trauma-focused therapy is. So if you are someone who's maybe waiting to be seen by therapists and you know that you're going to be using the cognitive behavior therapy for your trauma, or maybe if you are a training therapist, this video actually might be really useful to you. And also it is really important to add that actually to work with post-traumatic stress disorder or trauma, there are so many different treatments, but in today's video, I'm going to be only focusing on the one very specific, which is the cognitive behavior therapy. In the initial sessions, so it could be about 6 sessions or even more than that, we're going to be gathering information about your life. So we're going to be asking about your childhood. We're going to be asking about the time when the trauma happened, because obviously it doesn't always have to be that the trauma happened in your childhood. And we're going to be also gathering information how the post-traumatic stress disorder is actually affecting you in your current life. So whether maybe you experiencing any flashbacks and nightmares, dissociations, how often they happen, what triggers them, what level of distress you're experiencing when they happen. In addition to that, we're going to be also explaining you about the post-traumatic stress disorder, how does it work, how does it affect your body and your mind. So there's going to be a lot of normalization and as well psychoeducation. And in addition to that, we're going to be also trying to explain you what's going to be happening in following sessions so that you have better understanding, and that will perhaps as well help you with managing your anxiety about future sessions. And also in those initial sessions, we're gonna be looking at certain activities that maybe you used to do, but then you stop doing them because of the post-traumatic stress disorder. And we're gonna be also looking if maybe there's anything that you could actually start doing again, if you could engaging in certain hobbies, certain activities. And what is more, in those initial sessions, we're gonna also spend a lot of time on working on grounding techniques. And those grounding techniques, they are just activities that help you to relax, to calm down, and especially in situations when you're experiencing flashbacks, when maybe you have nightmares. And those grounding techniques, they're going to be also used in later sessions when we're going to be talking about the actual trauma, when you're going to be experiencing more distress in sessions. So the grounding techniques, they could be as simple as maybe using some essential oils with like really strong fragrance, or maybe having a rubber band on your wrist that could also help. That also will be included in your grounding techniques. Breathing exercise, muscle relaxation exercise. So there's so many different. So we're gonna go through different grounding techniques with you and see what actually works for you. So once we are done with those initial sessions where we do the grounding and the formulation, we should be somewhere around maybe session 6 or maybe 8. But that will really depend on a person, on their specific presentation, and on how they're experiencing the post-traumatic stress disorder. But once we feel that we've built the foundation, so means, while we're doing the formulation, while we're doing the grounding techniques, we're getting to know each other. We're building trust. We're building this professional relationship. And once the person feels more safe in sessions, once we have better trust, that's when we can actually start working on a trauma, on the actual flashbacks, for example, or maybe nightmares. One of the techniques that we can use within the cognitive behavior therapy is the imaginal reliving. So in this instance, we would ask the person to close their eyes if they feel comfortable to do that. If someone doesn't, they can have the eyes open. And then in the first person, in the present tense, they will have to speak, explain to us what actually happened to them at the time of the trauma. And I guess sometimes it might be that people, they might not feel as comfortable to all the details. Sometimes they might not even remember all the details, because actually that's part of the post-traumatic stress disorder, that the memory is very fragmented. It might take actually a few attempts before the person will be able to have a better, a fuller picture of what has happened during the trauma. As well, when the person is going to be talking about the trauma, we will try to encourage the person to talk about what they're feeling and what they're thinking and what physical sensations they feel in a body. With this technique, it is important to evoke as much sensations as possible, so that the memory becomes more alive, and the memory can be actually stored in a long-term memory. One of the reasons why actually the post-traumatic stress disorder is happening, why there's always this reliving, why the flashbacks are happening, is because the memories of trauma are actually not being stored in the right way. So by reliving it, we're trying to actually put this memory, the full memory, not fragmented one, but the full memory, in the right place. And by evoking, the emotions, the cognitions, the body sensations, that actually then helps the person to move that trauma memory into the long-term memory. And in some cases, it might be that actually this experience of reliving is too disturbing for the person. And maybe it evokes even dissociations for them, and even the grounding techniques that might not be working for them. So in those cases, we can actually ask the person to write down what actually was happening at the time of the trauma, rather than asking them to speak. And additionally, what is happening during this reliving is that we are able then to recognize what are the hotspots. And hotspots, they're gonna be those instances during the trauma that normally they trigger flashbacks. So they're gonna be the most intense. And also what happens during reliving, we want to know as well what meaning the person is ascribing to those hotspots. Very often, actually, people who suffer trauma, they might be attaching maybe self-blame or shame to certain memories. So then what we do, we try to actually achieve more balanced way of looking at this experience. So it might be that maybe we'll have to challenge certain beliefs that the person has, certain memories even that they have. We might be challenging that and to see if maybe whatever blame they're putting on themselves 100%, if that blame can actually be spread maybe across other people who have been involved, people who maybe actually inflicted the trauma on the person. And if the emotion is, for example, fear, normally that can be updated spontaneously during the reliving. But other emotions, such as maybe shame, blame, guilt, maybe anger, humiliation, those emotions that actually will need extra work. Once that problematic meaning is updated, so once the person actually is willing to maybe spread the blame between different people, once maybe the person is actually able to let go of that shame, then this memory can be updated. So then we can add this new meaning to this old memory of trauma. And how this is done, we actually ask the person while they're reliving to actually hold this specific memory in their mind. And that's when we introduce this new cognition. Another technique that we can use in cognitive behavior therapy when working with trauma is the imagery rescripting. So it's very similar to the other one, where we ask the person to speak in a first person, in a present tense. We try to evoke that old memory of the trauma, and we try to make it as vivid as possible. We help with additional questions so that the person has a better understanding of actually what has happened then. Because like I said before, those trauma memories initially, they are very fragmented. And once this is done, then we're gonna create a new version of the trauma. So new positive, with better ending trauma, so that the person can feel empowered and confident. Sometimes people, they can actually bring another person into that trauma image, and this new positive image is going to be then inserted into the old trauma memory in the process of reliving. And this is done because we have a research that actually tells us whether we imagine certain scenario or whether we actually go through that scenario in a real life, our brain's not going to be able to differentiate between that, and the same emotions can be evoked. So that's why when this imagery work is done properly, it can actually bring a lot of benefit to the person. And that's why when we work with someone in a therapy, we always encourage them to make these images as vivid as possible. And that doesn't go only for the old trauma memory, but also for this new updated version of the trauma. Whether it is reliving or whether it is imagery rescripting, these are two techniques that are actually very effective, but they're not going to be effective as well for everyone. They might not work for everyone. For people who maybe suffer from high level of dissociations, those are two techniques that actually might be too intense for them. I hope if you are someone who till now was hesitating about starting this type of a treatment, I hope that now you're gonna feel more confident that actually it is possible to go through this and it is actually helpful. If you found this video helpful, then please like it, subscribe, and make sure you're gonna hit the notification bell. So every time when I upload a new video, you're gonna get notified. And I'm gonna see you in the next one then. Thank you. Bye bye.